Hi everybody and welcome to our video series on basics of MSK physical exam. A tiny disclaimer, these videos aim to complement the content seen in class and thus are not meant to replace any didactic material. Nonetheless, enjoy the watch. Specific testing is the last step of the shoulder evaluation. For the AC joint, the scarf sign is going to produce pain at the AC joint if there is a ligamentous tear. If you suspect a tendinopathy, a bursitis, or arthritis, then impingement tests are key to confirm your suspicion. The Kennedy-Hawkins and the Neers test are two tests that are going to reproduce the patient's pain and confirm your suspicion and indicate that there is an inflamed structure in the subacromial space. In a history of trauma or subluxation, luxation, glenohumeral instability tests are usually indicated. The sulcus sign is done to assess the inferior glenohumeral ligaments. By pulling the arm down, a subacromial skin depression indicates a positive test. The load and shift test is used to assess the anterior and posterior displacement of the glenohumeral head. Increased range of motion versus the healthy side is a positive test. The apprehension and relocation test is a very useful one. It consists in a passive external rotation with the shoulder at 90 degrees of abduction. In this motion, the humeral head slides anteriorly and the patient will resist if there is an underlying instability. Assessing for tendinous ruptures or muscle ruptures is very important. The speed test is used to assess the tendon of the long head of the biceps. Pain or pain-induced weakness can indicate a tear in the long head of the biceps tendon or the superior labrum. The Yerkeson's test is also used to assess the tendon of the long head of the biceps. The maneuver differs from the speed test, so pay attention to the evaluators and patient's positions. Rotator cuff injuries are very common. Full can and the anti-can tests are going to help you elicit pain or weakness in the setting of a ruptured rotator cuff. The rhizome for external rotation assesses for the teres minor and the infraspinatus muscles. The hornblower sign assesses exactly the same structures, but the positioning is again different. The drop arm test is going to assess if there is a complete rotator cuff tear. If the patient is unable to keep the arm higher than 90 degrees, it is suggestive of a complete rotator cuff tear. Finally, the lift-off test is going to assess for the subscapularis muscle. If the patient is unable to maintain the full internal rotation and the hand off the back, it indicates a subscapularis injury. Next come the rhizome, which stands for resisted isometric muscle contraction or movement. It is a concept that is usually not taught in med school, but frequently used by MSK professionals to assess for muscle or tendon injuries, as well as their attachment to the bones.